Hello, wonderful seniors. Today, we're tackling a topic that's causing a lot of anxiety for many of you: recent changes to Medicaid. The landscape of healthcare benefits for seniors is indeed shifting, and a new, significant piece of legislation, often called the Big Beautiful Bill, is bringing major reforms to Medicaid. Understanding these changes isn't just important, it's absolutely crucial for maintaining your access to essential healthcare. Medicaid can be confusing enough on its own, with its intricate rules, and with these new provisions, it's natural to feel overwhelmed, perhaps even a little anxious. But here at Senior Wellness, we firmly believe that knowledge is power. We're here to break down these complex changes simply, clearly, and directly for you. In this video, we'll explain exactly what these new changes mean for your Medicaid benefits, how they might impact your coverage, and most importantly, where to get the trusted, personalized help you need to navigate these reforms and protect your essential healthcare. Think of it like navigating a new roadmap. It might seem complicated at first glance, but with the right directions, you can reach your destination safely and securely. So let's see why these changes matter to you. Many seniors, perhaps you or someone you know, rely on Medicaid for essential health care. This isn't just about a government program, it's about access to doctors, prescriptions, and often, vital long-term care. These upcoming changes aren't just bureaucratic adjustments, they directly impact your access to care and your peace of mind. For millions of seniors, especially those who are dual eligible, meaning you're enrolled in both Medicare and Medicaid, these changes carry an even heavier weight. If you're one of the many who rely on Medicaid to help pay for your Medicare Part B premiums, deductibles, or copays, these new rules could directly affect your ability to afford Medicare itself. Imagine the stress of suddenly facing those costs on your own. This is why understanding every detail of what's happening is so critical. While these changes can seem daunting, remember, you're not alone in this. Being informed is your best defense, and we're committed to empowering you with the knowledge to understand what's happening and what proactive steps you can take. So, let's dive into the specifics. The Big Beautiful Bill introduces significant Medicaid reforms primarily aimed at reducing federal spending. But what does that mean for you on the ground? First, there's a concerning freeze on eligibility and enrollment expansion. This bill puts a hold on two major Medicaid rules that would have expanded access for low-income or elderly groups. This includes provisions designed for improved enrollment in Medicare savings programs and easier qualification for Medicaid or CHIP. The impact? It could mean fewer people qualifying for assistance or making it harder to get onto programs that help with those crucial Medicare costs. Second, prepare for increased administrative burden and more frequent eligibility redeterminations. The bill now requires states to recheck whether someone still qualifies for Medicaid much more frequently. This could be as often as every 6 months. Imagine Mrs. Johnson, who has a small, fluctuating income from part-time work. Under these new rules, she might have to submit paperwork every 6 months. And a small change in her income or even a missed deadline could put her coverage at risk. This is designed to create more red tape for families, potentially leading to longer wait times and slower service, frustrating you with paperwork so that you might just say, "Forget it, I don't want this anymore." Third, let's talk about the significant shift regarding new work requirements, also known as community engagement. The bill mandates that certain able-bodied adults without dependents aged 19 to 64 will now have to prove they are working, volunteering, or participating in approved activities to maintain their Medicaid coverage. This is a new requirement for many in this age bracket. Here's where it truly impacts seniors. The definition of a dependent for these work requirements is primarily a child under 14. This means if you are a grandparent or guardian caring for a teenager aged 14 or older, who is otherwise fully dependent on you, you might now face work requirements to keep your Medicaid, even though that child relies on you. Furthermore, while individuals aged 65 and older are generally exempt, The application of these work requirements to adults up to age 64 could create significant hurdles for many older workers or caregivers not yet on Medicare. Fourth, there's the introduction of a new 35 copay. This copay will now apply to some Medicaid services, specifically for Medicaid expansion enrollees, with incomes between $100,000 and $138,000 of the federal poverty level. This provision is set to take effect starting October 1, 2028. While primary care, mental health, and substance use disorder services are generally exempt, for seniors on a fixed income, an extra $35 for other necessary medical services can be a significant burden. It could potentially make vital care unaffordable, forcing difficult choices between health and other necessities. Finally, the bill includes a pause on implementing staffing rules for long-term care facilities, specifically nursing homes. While this might reduce costs for facilities, it raises serious concerns about the quality of care for our loved ones who reside in long-term care settings. Experts predict that due to these combined changes, about 10 million people could lose Medicaid coverage over the next few years. This isn't just a number, it represents millions of individuals, many of them seniors, potentially losing access to the health care they rely on. So, with these significant changes on the horizon, what can you do to protect your Medicaid benefits? While these reforms are complex, being proactive and informed is your best strategy. First, stay informed and vigilant. This means paying close attention to any mail you receive from your state Medicaid office. Do not ignore it. These letters often contain crucial information about your eligibility, renewal dates, or new requirements. Make sure your contact information, including your address and phone number, is always updated with your state Medicaid agency. Second, if the new work requirements apply to you, or if you're a guardian of a teenager who is now considered non-dependent, make sure you understand these new rules thoroughly. Keep meticulous records of any hours you spend working, training, volunteering, or participating in approved activities. This documentation will be vital when it comes time to prove your eligibility. Third, prepare for redeterminations. With more frequent eligibility checks, you need to be ready. Start gathering all necessary documents before they ask for them. This includes income statements, proof of any assets, and verification of your household size. Think of it like preparing for tax season. Having your documents organized and ready makes the process much smoother and reduces the risk of being kicked off due to missing paperwork. Double-check all forms for accuracy before submitting them. Fourth, if the new 35 copay applies to you when it takes effect, start factoring this into your healthcare budget. If this creates a financial hardship for you, don't hesitate to discuss it with your doctor's office or pharmacy. They may be aware of assistance programs or alternative solutions. Finally, and perhaps most importantly, seek personalized help immediately. Do not try to navigate these complex changes alone. This video provides general information, but your situation is unique. The best course of action is to contact your state Medicaid agency directly. They are the ultimate authority for your specific eligibility and benefits. Additionally, consider reaching out to local senior centers, area agencies on aging AAAs, or state health insurance assistance programs (SHIPs). These organizations often have trained counselors who can provide free, unbiased, and personalized guidance on both Medicare and Medicaid. Remember, these resources are there to help you directly with your specific questions and concerns. Beyond the bill, what Congress could do for seniors. While this big, beautiful bill brings cuts and increased burdens, it's important to know that there are other legislative proposals currently in Congress that could offer real, significant relief to seniors, but were unfortunately not included in this bill. Knowing about these alternative proposals empowers you to understand what's possible and to advocate for changes that truly support seniors. One such proposal is the Social Security Expansion Act. If passed, this act aims to immediately provide every senior on Social Security, disability, spousal, or survivor benefits a $200 increase per month, totaling $2,400 annually. This aims to help seniors regain purchasing power lost to inflation over the past decade. Another vital proposal is the Social Security 2100 Act. This legislation is designed to give a substantial increase, for example, a $660 increase to seniors receiving the minimum Social Security benefit. This is particularly impactful, as it would help lift many of the 30 of seniors currently living in poverty, bringing them to 125 of the federal poverty level. There is also the idea of implementing a minimum cost of living adjustment, or COLA, for Social Security at 3.5. This would ensure that annual increases truly keep pace with rising costs, especially for medical care, rent, and other necessities, which often outpace current COLA adjustments. And in terms of food security, Congress could significantly help by increasing the minimum food stamp benefit for seniors from as low as $23 to $75. This would address the frustration many seniors feel about receiving very low benefits, making it more worthwhile to apply. Furthermore, raising the food stamps asset limit to $10,000 would allow seniors to have a little bit of savings for emergencies without being disqualified from essential food assistance. These are just a few examples of what Congress could do to provide real immediate relief to seniors. Beyond the current bill, your voice, through advocacy, can help push for these more beneficial changes. To recap, the Big Beautiful Bill introduces significant changes to Medicaid, including stricter eligibility rules, new work requirements for certain adults, including some seniors and caregivers, and potential future copays. These reforms could impact your access to essential health care. But remember, knowledge is power. By understanding these changes and knowing exactly where to turn for help, you can navigate this complex landscape with confidence and protect your essential health care. You deserve access to affordable, quality health care. Stay informed, stay vigilant, and never hesitate to reach out to official resources for personalized support. What are your biggest concerns about these Medicaid changes? Share your thoughts and questions in the comments below. We're building a community of informed seniors, and your voice matters. If this video helped you understand these complex changes, please give it a thumbs up. And don't forget to subscribe to Senior Wellness for more vital information and tips to empower your health journey.